Can you reverse type 2 diabetes? Is this a lifelong condition or is it something that you can get rid of? The short answer is yes, you can reverse it, but most people never will. If you're watching this, however, I'm guessing you're not most people. And part of the problem that you're probably up against is that the language around this disease is a mess. It's confusing. So in this video, I'm going to clear any confusion and show you what's possible if you have type 2 diabetes, but want more than just a pile of pills to manage it. My name is Dr. Adam. I'm a naturopathic doctor in Montana who helps men rebuild their health, starting with fixing any severe diseases, including type 2 diabetes. And this is the core of my message today. You weren't born with type 2 diabetes, it developed. And if it developed, that means it can undevelop. That's what reversal means. So here are 5 examples of guys I've worked with recently who have since reversed their diabetes diagnosis, beyond controlled, and what I believe is beyond remission. Let me start by defining 4 terms that you need to understand, but only one of them is really worth chasing. So let's start with uncontrolled. This is where most guys begin. So that means your A1C is over 7%, blood sugar is damaging your organs every minute it's elevated, and you're at risk of permanent damage every day that this remains unchecked. So if this is you, your first goal is to at least control it by using whatever tool that you're actually going to commit to. That could be medications, it could be diet and lifestyle. Because if you have uncontrolled diabetes and you're not ready to rebuild your health, then medications might be the best and only thing really to keep you stable. That's just your reality for now. The second term I want to talk about today is remission. So this typically means that your A1C is under 6.5%, out of the diabetes range, and you stayed off blood sugar lowering medications for at least 3 months. And that's a huge step forward from uncontrolled. So most of my clients get their A1C below 6.5% within 3 months of being serious about fixing this. And then they have the evidence for their doctor that suggests some meds are no longer necessary. And from there, it's a game of maintaining. But remission doesn't mean the insulin resistance is completely gone. If your A1C is still in the pre-diabetes range, that means that the insulin resistance is just quieter. Which brings us to our third term, reversal. So now we're talking real progress. This is where insulin sensitivity is restored. Muscle mass is up, visceral fat is down, and your body has regained metabolic flexibility. Now, obviously, there's no reason to be on meds at this point because your body's healed. You're not just out of the danger zone. You're not just controlled. You've rebuilt the engine. So this is the goal. And from there, the fourth term that you should understand is resilience. And this is the stretch goal, the long-term play. Because at this level, you can eat pizza again. You can travel, you can skip meals, you can get sick, and your blood sugar still holds steady. And that means that you've built a system that can bend without breaking. And that's strength. But that only comes after reversing diabetes and then staying consistent with your health strategy month after month. Now, one comment I hear all the time is this: if reversing diabetes is possible, why didn't my doctor mention it? In other words, if I can beat diabetes and potentially come back stronger than before I was diagnosed, why didn't anybody tell me? And honestly, that's a bummer to hear. I wish things were different, but you're hearing it now from me, and that's what matters. Because I don't know your doctor, so I can't tell you exactly why they aren't helping you reverse this disease. But here's what I've seen. Your doctor likely didn't mention reversal because A, they've probably never seen someone actually reverse diabetes like I have, or B, they just don't think you're capable of doing what it takes to reverse it, which is harsh, right? But that's the reality. If your doctor only has, 15 minutes with you every couple months, well, they're not going to have enough time or energy to walk you through all the lifestyle tools that you need. So they're going to write a prescription and just try to get your A1C under 7% controlled. And that's not because they're lazy, it's because they're trapped in a broken system. So can you reverse type 2 diabetes? Of course you can, but not by accident and definitely not by dragging your feet. Now, let me show you how reversal actually works. Men, who still has a real shot of pulling it off? So let's start with this. Lowering your A1C with medication is not reversal. I think we can agree on that. That's control. And control means your blood sugar numbers look better because of the medication. But the root issue, insulin resistance, is still a problem. So that's the management game. And like I keep saying, that's better than doing nothing, but it's also what keeps you stuck. Where reversal, on the other hand, means that your blood sugar is normal, you're off meds, and the results are coming from your body's own regulation, not pharmaceuticals. So you've rebuilt the system. That's real change. That's what we're after. Now, this is where the internet loves to argue. Is it really quote unquote reversed? Isn't it just in remission? And here's my take on this. It's reversed once you're off meds and no longer insulin resistant. Now, can it come back? Of course it can. Just like you can break a bone again or weight can come back after a diet. But to me, that doesn't mean it wasn't reversed. It just means you need to maintain the systems that keep you healthy. And I want to encourage you not to get stuck in all the terminology, because what matters most is your mindset and how you feel. I've worked with over 1,000 men at this point, and most of them make more progress when they adopt a reversal mindset versus a management or a remission mindset. Because, honestly, remission sounds passive. It just kind of sounds like you're hoping the disease stays away. Whereas a reversal mindset, it feels more active, like you took charge and you won, and you keep winning. And if the outcomes look the same on paper, we'll choose the stronger mindset frame. Now, let me give you a visual to make this super clear. So reversing diabetes is like healing a broken arm. I mentioned that earlier. So when I broke my arm, I didn't go back to lifting a kettlebell the next day. It went into a cast to remind me not to use it. But the cast itself doesn't fix the bone. Your body does most of the healing. But the cast does create a healing window. It protects from further injury and allows the bone to actually recover. Well, the same needs to happen with diabetes. If you keep slamming your metabolism with insulin spikes and poor sleep and sedentary days, it's never going to get the rest it needs to heal. So you need to protect the system long enough for it to rebuild. And that means cutting out the overload. It means changing the way you eat and train and recover long enough for real progress. And then eventually, just like with my broken arm, your metabolism comes back stronger. But again, only if you give it the chance. So here's the mistake most people make. They think diabetes is a blood sugar problem. So their version of a cast is to just eat less sugar. But type 2 diabetes isn't a sugar problem. That's a symptom. It's an insulin resistance problem. High blood sugar is a distraction, meaning you fix the cause by improving insulin sensitivity, especially in your muscle, in your liver, and in your fat cells. So that's the reversal formula. And the most powerful lever that I've found for men is muscle, because muscle is your glucose sponge. So the more you have and the more active it is, the better your body can handle carbohydrates. So what's the ultimate goal? Well, A1C under 6.5% equals remission. A1C under 5.7% equals reversal. Normal fasting glucose is a bonus. Stable CGM data, that's real-time proof. Just know that A1C is a lagging indicator. It's a 3-month average. So even if you're making big changes, it may just take a little while to reflect in your lab results. So don't panic, that's expected. Now let's talk about your odds now. So a study of 122,781 people found that only 1.6% achieved remission of their diabetes over 7 years. So obviously that's terrible. But the good news is that among the people who were diagnosed in the last 2 years, the success rate jumped to 4.6%. So still pretty dismal, but better. And to me, that means if you act early after diagnosis, your chances of reversal go way up. And that's because your pancreas can still recover. So your insulin producing cells haven't burned out yet. But this makes it clear that the longer you wait, the harder reversal becomes. This is why I tell my clients that your reversal clock is ticking. I found that you're most likely to reverse type 2 diabetes if a few things are true. First one is that you were diagnosed recently. So typically that means within the last 5 to 8 years. And if you have excess belly fat to lose, and if you are under-muscled, if you don't have severe complications like kidney failure or neuropathy, or you're ready to build muscle and lose visceral fat. It's a mental mindset thing. If you have structure and support, talking about like coaching and labs and data, all of these things suggest that you will be more likely to reverse this disease. The last thing is that you actually believe this is possible. And a bonus here on whether or not I think you can reverse this, I've found that you're far more likely to reverse diabetes if you're done outsourcing the responsibility. I think you know what I'm talking about. Because maybe your doctor didn't warn you, they didn't give you a reversal plan. Maybe pharmaceutical companies do make lots of money on their medications. But if you stay hung up blaming all these external factors, you'll never take back control and get this done. And look, even if a parasite was the trigger, which again, based on everything that I've read and seen, it's unlikely. The reality is that the parasite didn't create the environment. It just exposed it. So if you don't believe reversal is possible, and instead you want to blame things outside of your control, then I hate to say it, but you'll never commit hard enough to actually make reversal happen. True ownership of this problem sounds more like this. Yes, something threw my system off, but I'm in charge of rebuilding it. Now, why else do most people fail at reversing diabetes? Well, it's because they try to cut out sugar for 2 weeks and then they call it a plan, or because they try a DIY approach that doesn't work because they lack structure and tracking and accountability, or because they guess, they don't test, so they don't wear a CGM, they don't get the full blood panel, and then they give up because they don't see any results. So avoid all that, because this is a war of gradual progress. So you can't win it with quick hacks or even willpower. You win it with systems and consistency. Now, that means if you've been diagnosed recently, if you have some muscle to gain, if you're motivated and ready to take ownership and you're willing to do the work, then yes, I think you can reverse this. But you can't keep living like you did in your 30s, hoping that a new supplement or medication will save you. You need a new system. And most importantly, you need to believe it's possible, because your doctor might not. But I have seen too many men do this to actually pretend that it's rare. So don't settle for managed. Don't even stop at remission. Go all the way to resilient, because if reversal is on the table, why wouldn't you fight for it? So if you're ready to stop managing, start reversing, and you're looking for some support, I can help you build that plan. You don't have to do this alone. If you want to pursue this further, you can click the link below to watch the free training that I have or book a call to work with me. Just don't wait, because this clock doesn't reset.